Hey guys, Dr. Stephanie here, and today I want to talk a little bit about knee pain and more specifically posterior or back of knee pain. It's very common for people to complain of pain in the back of their knee, and a lot of times they don't know why it's happening, what's causing it, or how to fix it. So we're going to go over that today. So if you're having pain in the back of your knee, there are several structures back there. There's your hamstring tendons. So your hamstring muscles are here. The hamstring tendons run down across the back of your knee. And then the gastrocnemius, the calf muscle, those tendons run across the back of the knee too. So if any of those tendons get irritated, that can cause inflammation and tendinitis, and then that can cause that pain behind your knee. You can also get pain behind your knee from irritation in the knee joint. So if you have any arthritis, or a meniscus tear or anything wrong with the cartilage, a lot of times that causes pain in the back of your knee. So no matter the cause of the pain in the back of your knee, I'm going to show you some different ways you can get rid of that pain. So we're going to sit on the mat first. And I also wanted to say that sometimes when you have pain in the back of your knee, you end up not being able to straighten your knee all the way, which can lead to more pain because you're having that pain there, so it's uncomfortable or painful to straighten it, so you just don't. And then you get used to keeping it a little bit bent, and then when you try to straighten it, it doesn't straighten. So I'm going to show you how you can work on that too. So to start with, I'm going to show you a little mobilization for the knee. So you're going to grab a lacrosse ball or a tennis ball, place that behind your knee, and you want to do this sitting. So you can sit on the floor, you can sit in a chair, and you're just going to bring your lower leg towards you, kind of smash that ball behind your knee, and you want to hold at the knee, and you're just going to rotate your foot in and out. So that kind of rotates that lower leg, and it's kind of mobilizing your knee. So you're working on getting that knee flexion, so bending your knee, but you're also working on loosening those muscles behind your knee. So you just want to do this for a minute or two. And then from there, we can take a towel, and just any size towel, probably not too big of one. You're just going to roll it up and place it behind your knee, kind of like the lacrosse ball. And then this one, you want to take your lower leg and just pull back towards you, just as far as you can. You want to hold maybe 5-10 seconds, and then you can relax it and then do that again. This towel just kind of leaves a little space there, so it's kind of helping gap the joint so you have a little bit of extra joint space. So especially if you have some kind of joint issue, if you have a meniscus tear or arthritis, this can really help kind of open that space and make it feel better. You can also go in a kneeling position. So this is a little bit more advanced way of doing it. Keep that towel there, and you're going to sit back on your heels and then come back up. So this one you can hold 5 to 10 seconds, or you can just hold 1 or 2 and come back up. Just kind of sit back on there. Just get in a good stretch. Just like that. Okay, from there, we're going to start working on a little bit of strengthening, because if you're having pain there, we want to strengthen the quad muscle, the hamstring muscles, the hip muscles, pretty much all of these upper leg muscles to support that knee joint. So first, you're going to grab, I'm going to use this wheel, but you can use a foam roller or a rolled up towel or even a ball, whatever you have. You just want to elevate your knee, and then you're just going to straighten out your leg here and then slowly lower it back down. This is called a terminal knee extension, and it's really working on quad strength. So you want to do 2 to 3 sets of 10, like that. And then the other thing you can do while you have your wheel or foam roller or towel, if you're having any lack of extension, so you can't get your knee all the way straight, you want to place something under your ankle and just let that knee stretch. So let it straighten out as much as it can. And you just want to hold that 3 to 5 minutes. Just get a little stretch there. And then we're going to work on some more strengthening. So you're going to grab a yoga block or a step or a book or something you can place your foot on and lie on your back. And what we're going to do is a single leg elevated bridge. So you're just going to lift one leg up and then lift your body with the other leg and then back down. Lift up and back down. Now, if that's too hard, you can elevate both feet and do a double leg bridge. And then when you're ready, you can progress to that single leg bridge. You can also start on the floor and do a double leg bridge and then progress to the single leg. The single leg definitely works on your hip strength more and quad strength more, so that's where you want to go. But if you can't do that yet, it's okay to start with the double leg. Okay, then we're going to go ahead and stand up and grab a band. So just grab a loop resistance band, place it around your knees, and you want it to be right at knee level. So you're going to stagger your feet, and the leg we're working on is the back leg. So the front leg is just kind of there to hold the band, and the back leg is going to work. So keep that band in the back leg right behind your knee. Keep this front leg stable, so you don't want this to move at all. You're going to bend your back knee a little bit and then straighten it out. Bend it and straighten it out. This is also called a terminal knee extension, kind of like that first exercise we did. This is just in a different position, and we're adding some resistance. So you want to do 2 to 3 sets of 10, really focusing on pulling that leg back straight. And then we're going to make this a little more difficult. We're going to stagger our feet a little bit more, make sure your feet at shoulder width apart, and you're going to do a split squat, but we're going to do a hold. So go down into a squat, hold for 5 seconds, and then come back up. Down into a squat, hold for 5 seconds, come back up. This one you want to do on both sides. So then you alternate and do the same thing. Down 5 seconds, come back up. Down 5 seconds, come back up. Do that 10 or 15 times on each side. So all of that will work on your mobility of your knee and your strength of your quad and hip and hamstring, upper leg, and that will help to decrease that pain in the back of your knee.